Antibiotics are not always the answer. The discovery of penicillin in 1928 was heralded as a medical miracle. As one of the first antibiotics, it could cure patients of potentially deadly bacterial illnesses such as scarlet fever, typhoid, and pneumonia. Unfortunately, overuse of penicillin and other antibiotics can cause other problems for both individual patients and the general population. That's why it's important to take antibiotics only for true bacterial infections, including whooping cough, strep throat, and urinary tract infections. Antibiotics don't kill viruses. According to the U.S. Centers for Disease Control and Prevention, up to one-third of antibiotic use in humans is either unnecessary or inappropriate. Antibiotics do not fight viral infections such as colds, flu, bronchitis, and more sore throats. Still, many patients expect healthcare professionals to prescribe antibiotics to cure minor illnesses. Some patients who hate to see their child suffer will contact the doctor's office at the first sign of an ear infection, hoping for a prescription for antibiotics to quickly end the child's suffering, said Barbara Cole, a nurse practitioner with Penn State Medical Group. But the painful condition is usually caused by a virus. Although antibiotics kill most bacteria at first, some of the microbes survive and eventually become resistant to that particular drug. As a result, new, stronger antibiotics are developed to fight the resistant bacteria, and then the bacteria becomes resistant to them as well. The CDC says virtually all bacterial infections have become resistant to the antibiotic treatment of choice. Bacteria also become resistant when antibiotics are overused in food production and by farms, as in with cows and chickens. Just as in humans, antibiotics are essential in treating some diseases in animals, but using antibiotics just to promote the animal's growth leads to resistance, Cole said. When a person is infected with an antibiotic-resistant infection, medical professionals must resort to stronger, more toxic antibiotics to fight it and help that individual get well again. Illnesses last longer and in more cases lead to death. According to the CDC, every year more than 23,000 people in the United States die from bacterial infections that are resistant to antibiotics. Relief symptoms without antibiotics. Antibiotics are not the answer for every cold, flu, or ear infection, Cole said. Often a few days of rest and at-home remedies will cure a minor illness, she recommends. Cold or flu? Drink fluids, get plenty of rest. Comfort for a sick young child? Simply sit and rock him or her. Ear infections? Apply warm compresses. Runny nose? Use saline drops or sprays. Run a cool mist vaporizer. Elevate the head, such as by putting an infant in a car seat. Sore throat? Soothe with cool drinks, cough drops for older children, or honey for children at least 1 year old. When an antibiotic is prescribed, patients should be sure to take it correctly. Take each dose at the appropriate time to maximize the effectiveness of the drug. Take the antibiotic for as long as prescribed, even if symptoms are gone. Otherwise, some bacteria can survive and become resistant. Don't take leftover antibiotics or those prescribed for someone else. They may not be appropriate for current symptoms and could allow bacteria to multiply.